everybody. My name is Clarissa Nillo, and today I'm going to be presenting on measles. So, measles is a very controversial topic at this point in time, mostly because there's so many emerging cases, especially those within close proximity to us. But it makes me even more excited that I get to educate y'all on what the disease is. Okay, let's get started. So, measles is a public health problem. So I first wanted to start off by defining what measles is. So it's a highly contagious viral disease with symptoms that include high fever, skin rash, and white spots in the mouth. These are early symptoms of the disease. And as the disease progresses and worsens, symptoms include swelling of the brain and blindness and eventually death. So why is measles a problem? So measles is actually highly contagious, and about 90% of people exposed will get it. It is very it is a very high risk factor when children under 5 contract the disease because they are most likely to die from it due to their weak immune system. And there's currently no treatment or cure. How did this happen? So travelers and non-vaccinated people are a big reason why measles is spread and contracted. People who travel to other countries where the disease is prevalent often take it back home with them and expose a larger community of people. And pockets of non-vaccinated people living in close proximity to each other often keep the disease alive and growing. So the first case of measles was actually first documented in the 9th century by a Persian doctor, and it's made its way by 1650 to America, where its first case happened in Boston, Massachusetts. In 1912, measles became the first notable, or not the first, but one of the notable diseases in America, and it is actually still common in underdeveloped countries today. So what are the risks for the community? So if measles was to keep growing and more people were to contract the disease, it would lead to an epidemic and eventually leads to increased mortality rates and increased number of those who are hospitalized. The biggest, or one of the only reason, or one of the only etiological factors of measles is unvaccinated people in large populations. These unvaccinated people who have the disease often often expose themselves to vaccinated and non-vaccinated people, which allows the disease to manifest into something bigger. So how do we solve measles? So in 1978, the Center for Disease and Control had a goal to eliminate measles by 1982. They did not reach this goal, but they did have an 80% decrease in cases reported by 1981. By 1989, they recommended a second dose after the first initial dose for the vaccine. The Global Vaccine Action Plan was created by the World Health Organization in 2012. Its objective was to eliminate measles in 4 World Health Organization regions by 2015 and in 5 regions by 2012. Those regions weren't specified in the research I did. However, they did see an 80% reduction in death from measles by 2017. Like I said before, measles is still common in underdeveloped countries such as parts in Asia and Africa. And in Europe, there are actually a rising number of cases. So the European Vaccine Action Plan was implemented from 2015 to 2020. Its plans to have 95% of the population immunized. And by 2016, there was a significant decrease in amount of reports of measles. So how do we prevent measles? So there are actually 2 vaccines against measles, the MMR vaccine and the MMRV vaccine. Both can be administered in a form of a shot. The MMR vaccine is in 2 shots and the MMRV is in 1 shot. However, there is greater risk with the MMRV because you have a high risk of fever and seizure within 5 to 12 days of the vaccination. So it comes down to personal choice whether or not you want one or the other. Both protect against the same diseases and sicknesses. It's just a matter of whether or not you want to go in again for another shot. So preventative measures that have worked in the past have been public health policies to get the community members vaccinated. And this has been seen in the European Vaccine Action Plan and the Global Vaccine Action Plan, as well as the Center for Disease and Control Action Plan. And in general, prevention in the future, I believe that there just needs to be more education on the benefits of vaccines. I believe there's a lot of stigma that surrounds vaccines, especially false reports and accusations of what it could do, and also just increasing the accessibility of vaccines. I believe in the pockets of community members or in the undeveloped communities, there needs to be higher accessibility, especially if the vaccine is averaging about only $1 per shot. So we need to start making an action plan to get those vaccines to those people. All right, thank you for listening to my presentation, and I hope you have a great day.